Come in.
I'm washing my hands. Hi, Paul. How are you?
Doing just fine.
My name is Nancy. I'm a nurse from Harper College. How are you feeling today?
Doing just fine.
All right, good, good. I am here to do a neurological assessment. Is that okay?
That's okay.
All right. I'm going to start by just talking out loud about some things that I'm noticing, and then I'm going to ask you some questions.
Okay.
So first off, with the mental status portion of the assessment, I noticed that he is awake and alert, and that his speech is clear, and that he's appropriate. And now I'm going to ask you some questions about your orientation. Can you tell me what year it is?
It is 2016.
And can you tell me who the president is?
President Obama.
And can you tell me your name?
Paul.
And can you tell me my name?
Nancy.
And can you tell me where you are?
Harper College.
And why are you here?
For a general assessment?
For an assessment. All right. And so from that, I'm aware then that he is oriented to person, place, time, and situation. So when we do orientation, it's not *3, it's oriented *4. I'm also going to ask you some questions just to do some basic screenings that we do with all patients here at the clinic. Have you had, what I want you to answer is never, or most days, or every day. Have you had situations over the past 2 weeks when you've been so anxious you really can't function?
Never.
And any times in the last couple weeks where you were so worried that you just could not stop worrying?
Never.
All right, so that has to do with anxiety. I'm also going to ask some questions about depression. Any times in the last 2 weeks where you just didn't feel like doing the things you normally enjoy?
Never.
And any days where you felt just so blue that you really felt like you couldn't really function?
Never.
And then lastly, a couple questions about suicide. Ever feel so blue that you felt like life was not worth living?
Never.
And have you ever, in the last 2 weeks, been so blue that you felt like hurting yourself?
Never.
Oh, okay. So then he is negative for the screenings for anxiety, depression, and suicide. If he had answered yes or most days on any of those, then we would proceed with the rest of those screenings. And so then moving on with there, I'm going to do an assessment of your cranial nerves. So the first one we would do is cranial nerve number 2, where we would do the Snellen eye chart to test for acuity. And we did do this earlier, and what we found was that in the left eye he was 20/20 here, and then in the right eye he was 20/25. So this is for central visual acuity, that is cranial nerve number 2. And then for peripheral vision, we're going to do this test. Yeah, cover one of your eyes. All right, this is called the Confrontation test. And tell me when you can see my finger.
Now. 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 Now.
And then switch eyes. Tell me when you can see my finger.
Now. Now. Now.
Last one. Look straight at me.
Now.
Okay, wonderful. So that is cranial nerve number 2. And then moving on to cranial nerves number 3, 4, and 5. Can you take your glasses off for me? And then you're just going to watch this. You keep your head straight and just watch with your eyes. The 6 cardinal positions of gaze. This is testing cranial nerves number 3, 4, and 6, which are in charge of the extraocular eye movement. And I expect his eyes, his pupils, to move in a conjugate manner. Follow this in, and then for accommodation, I expect convergence of the axis of the eyes and constriction of the pupils. And then continuing on with cranial nerves number 3, 4, and 6, I'm going to shine a light right into your pupils for the pupillary light reflex. And I see that the pupil constricts when the light is on the pupil. Okay, you can put your glasses back on. And then for cranial nerve number 5, I want you to clench your teeth like this. Show me your teeth. And what I'm feeling here is that I feel the muscles on both sides tense up, because that cranial nerve number 5 innervates those muscles there. And there's a sensory portion to cranial nerve number 5 as well. Close your eyes. Tell me when you feel the wisp of cotton.
Okay. 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 Okay.
All right, so that's cranial nerve number 5, and we already did 6 when we did 3, 4, and 6. So then we're going to go to cranial nerve number 7. Can you smile and frown? And then lift your eyebrows up, and then squint your eyes closed really tight. And just relax. And what I was looking at through that was symmetry of the face I'm looking for symmetry of the eyebrows, the eyelids, the nasolabial folds, and the corners of the mouth, and it was symmetrical, so cranial nerve number 7 is intact. And then moving on to cranial nerve number 8, I'm going to whisper something. I'd like you to repeat it back to me.
Assessment class. Black shoes.
Okay, so the whisper test went well, and cranial nerve number 8 is intact. Then we're going to move on to cranial nerve number 9 and 10. Can you open your mouth really big and say, ah? And I see that the uvula and the soft palate rose, which is appropriate, and so 9 and 10 are intact. And then cranial nerve number 11. Can you turn your face against my hand? There you go. And again, the other way, press hard. Good, and shrug your shoulders against my hands. Good, and that's cranial nerve number 11. And then cranial nerve number 12. Can you stick your tongue out? All right, you can put it back in. The tongue's in the midline, and that's cranial nerve number 12. So that concludes the assessment of mental status and the cranial nerves.